Look around your office, your kid's school, or just about anywhere you happen to be, and you will no doubt find plenty of runny noses. I happen to be one of them this week. There are lots of reasons for it, of course. The common cold and basic allergies are top of that list, but something that's just as common but oftentimes overlooked is called sinusitis. Dr. Ashish Shah with Ohio ENT and Allergy Physicians is here to tell us what we should be looking for. So thanks for being here, doctor.
Yeah, thank you for having me.
So let's start with the basics, of course. What are our sinuses? What are we talking about when we talk about that?
Well, sinuses are hollow cavities in the facial skull. They're lined by a mucous membrane, so they secrete mucus, which drains through little tiny openings into the nasal cavity. The function is to reduce or lighten the facial skeleton, enhance our immunity, and warm and filter the air we breathe.
Okay, sounds delicious. All right, let's talk about sinusitis, because this is something that is happening to a lot of folks right now.
Yeah, it's extremely common this time of year. The sinusitis is technically inflammation or swelling in the sinus cavities. Most often this time of year, it's going to be from a viral infection that causes that swelling. The typical symptoms are going to be facial pressure, severe congestion, lots of mucus drainage, reduced smell, coughing, fatigue, tiredness. It's going to be much more severe than the average upper respiratory infection.
Right, it's different than just having a common head cold.
Correct, yeah.
So is it possible to avoid that?
Yeah, so there are steps that people can take to minimize their risk of having a sinus infection. It's always important not to smoke or to quit smoking, avoid secondhand smoke. Hygiene precautions are also important. So this time of year, it's very important to wash your hands thoroughly and avoid contact with people that are sick. We do find people that have a lot of allergic sensitivities, so we do work with our allergy colleagues closely to identify allergic triggers and manage those effectively to reduce sinus infections.
Okay, because it could be kind of a mix of infection. Is there a remedy? Is that something we should fight through, or are we taking some medicine?
Yeah, if it's minor symptoms, then certainly let it ride. It's usually viral. It's going to clear up. Ibuprofen or Tylenol should help sufficiently. A simple home remedy is steam, boiled water in a pot or a pan to help loosen and alleviate mucus drainage and loosen things up. Another remedy that we often advocate is saline rinses or lavage, which is an irrigation solution with salt water. The classic way to do this is with a neti pot. There are squeeze bottle versions of them and pressurized canisters and mechanical devices to irrigate the nose. They're available over the counter, but the method involves basically salt water going in one side of the nose and coming out the other to basically clear out mucus and help improve symptoms. There's also over-the-counter medications such as oral decongestants, but people with hypertension need to be careful about using those medications. There's mucus thinning medications as well, and also nasal spray decongestants are available over the counter, but people have to be careful that some of these medications can cause rebound congestion, and people can almost get hooked on them.
Yeah, so the nasal sprays, I know that's been an issue with people getting hooked.
The over-the-counter
They love how it feels.
Correct, yeah.
So they keep using it. So be careful. So at what point does surgery become necessary for someone?
Yeah, well, going back one step, we do, so you mentioned the antibiotics, or we talked before we came on. Antibiotics, we typically avoid those until it's been about 10 days of symptoms. So we try to, we know it's viral and symptoms usually resolve, but if it's worsening after up to a 10-day period of time or after 10 days, then an antibiotic would be helpful for those acute symptoms.
Okay.
Surgery, basically, we do see people that have chronic issues, so meaning symptoms have been present for more than 12 weeks or that they have recurrent issues several times a year. So those people who come to us, we will do some investigations to evaluate why they're having a problem. We will pass a little tiny telescope inside the nasal cavity to examine their nose, and we'll do a CT scan of the sinuses to evaluate their sinuses. So what we're looking for is chronic swelling in the sinuses, chronic blockage of the openings, deviated septum, abnormalities like polyps, which are mucus-filled sacs. So we're looking for these types of things that might be causing them to have more problems than the average individual. Under those circumstances, some of these patients are candidates to have a minimally invasive procedure where we actually go in the nose with a little tiny telescope to open up those sinus cavity openings to allow and facilitate better drainage.
Okay.
So that's all internally, nothing's external with that. So there's no bruising or swelling or incisions on the outside, for instance.
So even if you get to that point, it's a pretty non-invasive procedure. But if you start out, I'm sure coming into Ohio ENT is a great place to start to kind of see where you stand and if you can take care of those issues, right?
Correct. Yep. Absolutely.
All right. We have the website, of course, and the phone number up on screen. So I want to thank you, Dr. Shaw.
Yeah. Thank you.